In a geriatric surgery program, we take several steps to find out about your memory and behavioral health before your operation. To provide you with the best care, it's important for your surgical team to know your mental state. Communicating with your doctor before your procedure about your thoughts, feelings, and behaviors is important. Your provider needs to have an accurate assessment of your memory. Some questions they may ask include: have you had problems with your thinking in the past? Have you been forgetting words and places? And have you been having sleep issues? Assessing your mental state before surgery provides key information for your surgical team. They will need this information to take measures that will address potential complications after your procedure. Cognitive and behavioral states like depression and anxiety can be made worse after surgery. Whether they are pre-existing or occur after surgery, these changes can lead to negative outcomes like confusion or longer hospitalizations. As part of a larger assessment, your providers will conduct several risk screens during your pre-surgery workup, including the assessment of your mental state. An example of one of these screening tools is the Montreal Cognitive Assessment, a 30-question screening tool that assesses several cognitive domains, including short-term memory, executive function, attention, language, and orientation. It takes about 10 minutes to complete. Another example is the Mini-Cog, a 3-minute screening tool that tests recall. Another part of your pre-surgical assessment may include a screen for depression and anxiety, as these conditions can affect your recovery. One common screening tool your surgical team may use is the Geriatric Depression Scale. It's a short yes/no questionnaire that asks how you've been feeling over the last week. During your recovery, your surgical team will repeat these cognitive and mental health assessments to best address your needs. If any of these assessments indicate a need for follow-up, your surgical team will refer you to the appropriate specialists and support services. Poor sleep hygiene can affect your mental state and contribute to stress, anxiety, and memory loss. To preserve your mental state both before and after surgery, it's important to get 7 to 9 hours of sleep a night. Tips for getting better sleep include limiting caffeine and naps to before 3 p.m., keeping a regular sleep schedule by going to sleep and waking up at the same time each night, having a wind-down period before going to bed, such as avoiding potential stressors and engaging in a routine to tell your brain it's almost time for bed, avoiding looking at screens while in bed, and exercising during the day. Remember, talking with your provider about your memory and behavioral health is an important part of the surgical process. By monitoring your mental status, your surgical team will be able to effectively manage your care during the surgical process. Additionally, good sleep hygiene facilitates recovery by increasing your mental and physical ability to prepare for and recover from your surgical procedure.